everybody, welcome back to the Medical Projects YouTube channel. If you are new around here, hello, my name is Olivia and I am a second year medical student at King's College London, and here on the Medical Projects YouTube channel we create videos every single week to assist you in obtaining that dream place at medical school. So I'm here to offer all of my bits of advice that I've learned in my own application process and my own medical school journey to hopefully boost your application. If you are new around here, please do make sure you do subscribe to this channel and turn on the notification bell so that you can be notified every single time that we post, and do make sure to also hit that like button. So for today's video we are continuing on with our interview series because of course the medical school interview season is already upon us. So for today's video I thought I'd talk about how to tackle 3 very commonly asked interview questions, and those are going to be covering why medicine and why not nursing, what is your biggest weakness, and why this university. So I do hope you find this video informative and helpful, and without further ado, let's get on with it. So the first question, why medicine, is one that you can almost guarantee is going to come up in your interview, and although it seems quite straightforward, it is actually quite a tricky one to answer well. So my top tips for this question are, firstly, think about the things that made you want to pursue medicine, and this doesn't have to be an elaborate personal story, although many people will have picked medicine for this reason. It could simply be because you absolutely love science and you want to be in a career where you're marrying, heavy scientific content with the constant communication with patients every single day. Be honest, and if it's applicable, try and draw in some bits of your work experience that really solidified for you that medicine was going to be the right career. Now, my ultimate biggest tip with this question is, wherever possible, identify the traits that are necessary in order to be a good doctor. So things like being empathetic, having good communication skills, being a good leader, and showing resilience. Identify these qualities and then wherever possible, demonstrate to the examiner that you already have these. So you might say, I want to be in this career because I really like the thought of working as part of a bigger team, in a multidisciplinary team, and I think that I already have really excellent teamwork skills that I've developed whilst being a part of a football team every single week. Or I want to be in a career where I'm utilising my excellent communication skills, which I already think I possess because I teach a bunch of the younger students and help to tutor them every single week. They want to know that you've identified these qualities, but more importantly that you yourself have them. Now, when it comes to answering why not nursing, this is where a lot of people find themselves in a bit of hot water, and that is because many candidates fail to acknowledge the importance of nurses and how their roles are very distinct from doctors. So my tip for this question would firstly be to acknowledge the importance of nurses and then demonstrate that you know where their roles are very distinct from doctors. So you might say that nurses deal more with the continuity of the patient's care, whereas the doctors are behind the scenes trying to problem solve and diagnose exactly what is going on with the patient. So you might want to again pull in your work experience and say, I shadowed a bunch of doctors and nurses, and I noticed that the doctor was often behind the scenes looking at x-rays, prescribing medications, investigating different scans, and really putting together many different pieces of the puzzle to identify what was wrong. And I think my skills lie more in the problem solving aspect rather than the being with the patient every single day and caring for their daily needs. So overall, my biggest tips for this question is, be honest with your reasons, try and give examples of where you've shown that you have the qualities necessary to be a doctor, and acknowledge the importance of nurses and show the examiner that you understand where the roles are very distinct. The next question we're going to be covering is, what is your biggest weakness? And this is a tricky one to think about because we can either be too self-deprecating and go down the road of just stating all of our weaknesses, which is not what you want to do, or we can be too arrogant, and that's also not what you want to do, because you don't want to say, I'm too good at everything, or I work too hard, because that isn't really a weakness, and they want to see your genuine response. So my top tips for this question are to firstly identify one of your weaknesses, but make sure that it is not integral to being a good doctor. So, you don't want to say things like, I tend to lack a lot of empathy, because the examiners are going to be thinking, okay, well that's quite an integral part of being a doctor, so perhaps you're not the correct candidate here. Instead, try to choose something that's perhaps a bit more more subtle. So I think in my case I said that I overthink things an awful lot and it makes me worry. So then you want to contextualize it and say, you know, for example, if I don't perform so well in an exam, I find that I dwell on it and then often it can affect my performance later on in subsequent exams. But the most important part about this question is you want to talk about how you're trying to or already have rectified this weakness. So I might say something like, you know, I tend to dwell a lot on things, and although this means I'm very methodical and I get the job done to the best of my ability, it tires me out a lot and I find that I often get quite overworked. So in order to work on this, I make sure that I talk to my family and I reflect on what has gone on, I write things down, and then I try and compartmentalize that and put that to one side so that it doesn't affect my future performance. And then you want to again put it in the context of a doctor and say, you know, I believe that in the future this will mean that I'm very conscientious and I look after my patients very well, but I might have a tendency to get a bit stressed. So I'm going to make sure that whenever I start feeling that way, I'm going to be talking to personal tutors and I'm going to be talking to, you know, colleagues and seniors to make sure that I don't burn out. So when answering this question, my overall tips are to be honest with your weakness, but make sure it's not something that's really pivotal to being a good doctor. Talk about the challenges you face by having this weakness, but maybe talk about some positive aspects of having this weakness if that lends itself to it. And then most importantly, talk about how you're trying to rectify this problem and how you might tackle this problem in the context of being a doctor. The final question we're going to cover is why this university? And again, this is a question that you can almost guarantee is going to come up, and it's something you really need to be mindful of, especially if you're picking a university where there are other universities in the area. So for example, if you're applying to a London university and you're applying to King's, you know, they might say, why not Imperial? Why not St. George's? Why not Bart's? And you're going to have an answer ready for them. Things that I think you should be considering when it comes to this question is firstly, what type of course is this university offering? You might say, I picked this university because firstly, I really like the curriculum. It's an integrated curriculum, which means that we have early clinical exposure and we also have a more traditional style of teaching. Or you might say, I picked this university because it has problem-based learning and I like working as part of a team to kind of problem solve. You might want to talk about the location and some of the unique facilities that the university has to offer. So for example, in King's College London, there is an amazing simulation suite and that simulates a hospital environment. Other things you could consider are, does the course offer cadaveric dissection or is it prosection, and which one you prefer, and then maybe talk about why you think that would facilitate your learning. You might want to look at the assessment style and talk about how that suits you, but overall they're going to expect you to know what the course is like inside out, and they'll want you to be able to identify the highlights of their curriculum. Don't fall down the trap of saying something really generic like, this is a really good university to study medicine and I'll just be happy getting into wherever I do. They want to know exactly why you have chosen that university. So they want you to identify the things that are on their prospectus and the things that make that university really unique. So those are 3 very common questions you'll often get asked in your medicine interview. I hope you found this video informative, and do let me know if you have any interviews coming up and if you got asked any of these 3 questions. A lot of the questions you'll be faced with in your medicine interview are not that difficult, but the main thing is just to ensure that you have a really clear structure to your answer and you want to look like you've really thought about this carefully. It would be a shame if they caught you off guard with a question that is quite easy to prepare for, like one of these. So I hope you guys enjoyed this video. Please do make sure you click that subscribe button and comment down below if there's anything specific you would like to see from us. If you haven't already, do make sure you check out our previous videos in our interview series all about medical ethics, and then we also did one on a roleplay scenario about breaking bad news. Thank you guys so much for watching. I really hope you have an enjoyable yet safe Christmas holidays, and from all of us at Medical Projects, we wish you a very happy Christmas.